one of the things that I know all health systems are working on now, but we're not quite there, is figuring out how we maintain and support the mental and physical health of our nurses. We don't like to talk a lot about physical health, but nursing is a physical activity, and we need our nurses to be healthy so that they can take care of their patients. So, thinking about programs that are well resourced when it comes to mental health, well resourced when it comes to physical health, having gyms available, have making sure that nurses have wellness breaks and not just breaks to eat in 15 minutes. I know when I was a nurse, I this is how I eat fast now. 15 minutes was all I had because that was the only opportunity that I had. That's actually not okay. We need to make sure that there's scheduled breaks. We have to make sure we have appropriate staffing. And I think the biggest piece for me that I don't think I realized early in my career is making sure we have education and training around wellness and how we can create work-life balance. Because sometimes we say, "Oh, we're going to support you, and there are resources for mental health, and there are resources, there are gyms, and there are things that you need to do to eat better and exercise." But we're not, as nurses, we're not always trained in how to do that. And so having that education and training to be able to support that is important. And being individualized in that approach and customizing that for each nurse is really important, which is where I think the nurse leaders play such an important role in making sure that they're supporting each of their subsequent nurse leaders and nurses in their teams. So I think that really will help us to increase the overall nurse well-being and really promote work-life balance.